Thank you very much. As you heard, I'm filling in for Dr. Laws today, but I want to start off by acknowledging Dr. Hazel Laws, our CMO, who was very active in getting this presentation together, along with Dr. Rafael Rosales, the epidemiologist, and Dr. Marissa Catty. They were the ones who were responsible for this presentation. Now, to date, the Federation has a total of 22 cases, 16 in Nevis, 16 in St. Kitts, 6 in Nevis, and that brings our rate of infection to 41.3 per 100,000. Because we have a very small population, every time we have 1 or 2 cases, it will increase our infection rate. However, what the CDC and the World Health Organization look at is the rate per 100,000 every 1 to 2 weeks, and that rate for us is very low. But we just wanted you to see the numbers that we have over the last 8 months of this pandemic. Globally, the virus continues to spread, and to date, we have over 63 million confirmed cases globally, with 1,469,402 deaths. In the United States of America, just north of us, the virus continues to spread there also, and actually every state now there is considered a hotspot with over 13 million confirmed cases, and to date, 270,643 deaths. Actually, yesterday they saw their worst day since the pandemic, with over 90,000 persons hospitalized from COVID-19 and over 2,600 deaths. And today, so far, you have about 1,300 deaths so far, and the day is not over as yet. So those of us who are here living in this bubble and thinking that the pandemic is over, it is not over. There are a number of countries around the globe that are still struggling with the pandemic. In the CAFA region, we have over 61,000 confirmed cases with 1,294 deaths. And in the Caribbean at large, we have over 291,000 cases and 5,146 deaths. And I'm happy to report again that St. Kitts and Nevis has not made any contribution to that death toll, either regionally or internationally. We continue to do what we need to do, however, that is testing those persons who need to be tested. And so far, we've tested 4,256 persons. And our positivity rate is very low, 0.4%. Countries should aim to have a positivity rate below 4%, which means that we are doing quite well. We have about 7 tests that are pending. Okay, the number of persons who are in pre-approved home quarantine are 11. Persons who are quarantined in other facilities, 301. And we have 3 persons in isolation. Those were the 3 cases that you heard about over the last week. The number of persons who were released from quarantine, 2,423. And we have 19 persons who are completely recovered. Now, this is Dr. Law's Edu Corner. Can we have the next slide? We always like to update you on the travel protocols, and you can go to www.knatravelform.kn for the information that we give you here. But despite the fact that it's available online, persons always ask questions. And so the next slide, please. We all know that to come into the Federation, you need to submit a negative PCR test, and this is the reverse transcriptase polymerase chain reaction test that must be done by an accredited laboratory, and this test must be submitted within 3 days of travel. Persons ask about whether or not children need to be tested. It's important for you to know that of the 22 cases that we had here, 3 of them were children. And so yes, the Federation of St. Kitts and Nevis require that all children be tested also, and the protocol is the same. The test must be submitted within 72 hours of travel. And of course, these children, if they're coming, they must be accompanied by an adult, because a child will not be able to be quarantined by themselves. And so children need to be traveling with an adult because they're going to have to go into quarantine. As it relates to travelers with special needs, just today I got a call asking about this, somebody who went away for treatment and was coming back. And so if you are a traveler with special needs, it's important for you to contact the CMO's office. You can email office of the CMO at gov.kn. And these persons, we talk about persons with medical conditions, disabilities, etc., who might need special arrangements. Now, by sending your information to the office of the CMO doesn't mean that you would be exempted from quarantine, but we'll make sure that all the safety precautions and any prerequisites that are needed are put in place so that you can be safely placed in quarantine without having any adverse effect on your pre-existing condition. We have said over and over again that it is only through an effective vaccine that we'll see our way out of this pandemic, and the COVAX facility, which is a part of the ACT process involved in getting the vaccine on board, is what is instrumental in helping us get this vaccine ready for the rest of the world. And this is a global initiative that is led by Gavi, the Alliance for Vaccination, and the World Health Organization. And basically, this is a way of pooling the risk, pooling resources together and procuring the vaccine on a global scale and making sure that when it is available, it will be equitably distributed to everyone around the world, because we know that no one is safe unless everyone is safe. And there is no point in us having a vaccine that is available to the first world countries and the less developed countries would not have this vaccine, because the world is so small and there's interregional and international travel. We need to make sure that the vaccine is equitably distributed across the world, and that's what the COVAX facility is for. Now, the overall aim was to accelerate the development and manufacture of the vaccine and make sure that it's available. And we're happy that there are 2 vaccines that are going to be having emergency use authorization. So whereas in the past, prior to COVID-19, the vaccine that was fastest developed was the measles vaccine, which took about 5 years, we have been able to have this vaccine coming on board in less than 1 year. So most persons woke up to the good news that there was emergency use authorization granted in the UK for the use of the vaccine that was produced by Pfizer and BioNTech. And this vaccine has a very high efficacy, an efficacy of about 95%. And we can be assured that the vaccine is safe. And so this vaccine will be ready for use in the UK over the next week. The interesting thing about this vaccine is that it needs to be kept at a temperature between -70 to -80 degrees, and so it will require special freezers or being shipped in special containers with dry ice to keep it at that temperature. Once it reaches to the destination, however, it can be kept in the refrigerator for up to 7 days. This vaccine requires 2 doses that are given 21 days apart. So, for example, you might hear a country ordered 40 million doses. That would be for 20 million persons, because you require 2 doses that are given 21 days apart. And the vaccine uses an mRNA genetic type coding to prime the immune system. And the person starts to develop immunity about 7 days after the first injection. So we said that the UK was the first to give emergency use authorization of this vaccine, and I'm very happy that the first world countries out of the gates with this vaccine, and very soon we might be hearing about the emergency use authorization in the US also, because they have applied for this. And since these are our main tourist sources, the UK, United States, it will be good if they get the immunization before us to ensure that we will be safe. And so the UK, they're going to have about over 800,000 doses available in the first instance. They have ordered 40 million doses, which will be enough for 20 million persons, since you require 2 doses. Now, sometimes persons ask, how would one determine who gets the vaccine? It's done on a scientific basis, and basically it is thought that the persons who need the vaccine most, those are the ones who should get it. So the persons who will be greatest at risk are the frontline healthcare workers, And without the healthcare workers, you won't have a health system. And so those are the persons who will be given priority, and also the persons who would suffer most from COVID-19. And we have to understand that although we're speaking about COVID-19, the number of persons who have other pressing health matters that they're having to deal with in addition to COVID-19. And so persons with pre-existing condition, the elderly, the vulnerable, those are the persons who would be next in line. So the three group of persons who would be getting it, healthcare workers, persons in healthcare facilities, and the medically vulnerable, or persons with significant pre-existing conditions. Some may ask, well, when would we receive the vaccine? We are hoping that the Caribbean will get the vaccine around about March or so. But you never know, these figures might, we might get it before that. Early on, most persons were saying that we would not get a vaccine before the end of the year. And you see within another week or so, the vaccine would be placed in persons, that is vaccination in the UK in the next week. And so maybe the production might be speeded up such that we might get it earlier than March, but that is the predicted time. So, okay, I'm just looking at this slide for the first time. So how can we protect ourselves? Let's put a slide. How can we protect ourselves? We just need to continue doing what we were doing before we heard about the vaccine. And so we need to wear the mask, maintain proper physical hygiene, maintain the 6 feet distance from persons, and also avoid crowded spaces, because we have to understand that if you're in a crowded space, to put it bluntly, you would be swapping air with other persons, and that would increase your risk of getting the virus. And so if you can avoid these crowded places, super spreader events, then we can keep ourselves safe until next year, March, when hopefully we will get the vaccine and get us out of this crisis. Thank you.